Ethan, good to see you. So glad we get to talk today. We have Medicare 101, everything you need to know before you sign up or switch plans. Picking the right Medicare plan for you is so very complicated. So today we're fortunate to speak with you, a specialist, to answer all of our questions. So since this is your area of expertise, what question or misconception do you hear most?
Yeah, the biggest misconception and questions I get is when it comes to late enrollment penalties.
Mm,
Day in and day out, this advertisements you're receiving in the mail or agents you're talking to are talking about these penalties that you could get if you don't enroll in Medicare right away. The penalties are very real, but if you still have group insurance, it may not be necessary. And if you're going to Medicare right away, then you do want to worry about those penalties. But that's probably the misconception I get the most is that you need to enroll in Medicare right away, but it really just depends on your personal circumstances.
okay, so let's clarify a couple things. When does Medicare start and what deadlines do I need to keep in mind?
Yeah, so Medicare will start based on your birthday month turning 65. And now it all starts on the first of the months. So even if your birthday is at the end of the month, let's say for instance it's December 30th, your Medicare coverage would start as of December 1st. But you have a 7-month window to enroll in that. So you'd actually have from September 1st, 3 months before you turn 65, as well as until the end of March, 3 months after you turn 65, to be able to enroll in Medicare A and B.
Okay, so let's get into it now. There are four parts to Medicare, A, B, C, D. I would like to start by talking through part A first, please.
Yeah. So the biggest difference that you're going to have when you go into Medicare is they break up the hospital medical coverage compared to your group insurance. Medicare Part A is commonly termed your hospital insurance.
Mhm.
That's going to be covering your inpatient care, your nursing facility care, such as a rehab or long-term care facility, hospice care, and home health care is all covered under Medicare Part A. One illustration of this is if you went as an inpatient in the hospital for open heart surgery, you then get moved to a nursing facility to aid in the recovery. You go home to get home health care and then go on hospice later on, is all covered under Medicare Part A.
Okay, and how about part B?
Now, Medicare Part B is picking up the rest of the medical coverage outside of that. It's commonly termed that medical insurance. Medicare Part B is taking care of your primary care visits, your specials visits, outpatient care, as well as your durable medical equipment, as well as preventative, lab work, diagnostic testing is all covered under Medicare Part B. What you will notice between A and B is I didn't mention routine dental, routine vision, or hearing care. With just Medicare A and B, they don't cover those additional coverages or your prescription drug coverage either.
Okay, so now we're going to skip C for the moment. Let's talk through part D. What is it and do I need it?
Yeah, so Medicare Part D is easy to remember because it's part your prescription drug coverage, D for drugs.
Mhm.
This is an optional program that you can either get on a standalone drug plan if you have original Medicare or included in your Medicare Advantage plan. It's a program to help aid in covering the cost of your prescription medications.
Okay, do I need it now or can I add it later?
Yep. So it's always encouraged if you go onto Medicare right away to enroll in it right away, even if you aren't taking any prescription drugs,
Okay.
because there are penalties involved if you don't enroll in it right away and you decide to later on enroll. But also, is you can't predict the future. If you do go on an expensive medication, you can't enroll in a drug plan in the middle of the year now. You'll have to wait until the open enrollment and have it start the first of the next year.
I see. Explain how the Inflation Reduction Act changed Part D.
Yep. So the Inflation Reduction Act really changed Part D for the better overall, but a lot of changes took place. In the past, your Part D coverage, no matter how much you paid, had no limits on how much you could pay in prescription drugs. I had some clients that were paying $6,000 in prescription drugs.
Wow.
Now the limit is $2,000. Once you've paid $2,000, then it covers 100%. But because now there's a less of a limit on how much you can pay, the insurance companies are still having to cover those costs. So a lot of premiums have increased,
Mhm.
co-pays, co-insurance have increased. So ever more so is it important to be reviewing your coverage each and every year because of these major changes and how it could affect your current coverage.
I see. Okay, so now let's hop back into Part C, the Advantage Plan. Some say you need it, others say you don't.
Yep. So Medicare Advantage Part C, It can be a very beneficial plan, and it depends on the area that you're in, quite honestly. Medicare Advantage is taking over the original Medicare coverage for yourself, and it really comes down to personal preferences. Just because your neighbor's on that plan, it works really well for them, does not necessarily mean it works really well for yourself either.
Mhm. So, what is the primary difference then between using a Medicare supplement and the Medicare Advantage plan?
Yep. So the difference between those is the Medicare supplement has been around since 1966. Medicare started in 1965. So they've been around a lot longer. And it works with your original Medicare. As long as the doctor accepts Medicare, you can continue to get that coverage throughout the entire US with your Medicare supplement plan as well. But you usually pay a higher premium for that. So you pay more upfront and potentially less on the when you actually are getting the care.
Hmm.
Medicare Advantage.
Go ahead.
So Medicare Advantage, though, the difference between that, though, is Medicare Advantage is through private insurance. So instead of the government be handling your Medicare, now it's a private insurance company that handles your Medicare benefits. All that we discussed for Part A and Part B is still covered under Medicare Advantage, but it works like a group insurance. There may
I
be
see.
networks, co-pays involved, and Medicare Advantage isn't new either. It's been around since the 90s, and as we know it today, since the early 2000s as well.
Hmm. I'm so grateful for your time and expertise because this is overwhelming. So, how do you even begin helping a client determine what he or she needs?
Yeah, well, like I keep mentioning throughout, is it really depends on personal circumstances.
Yeah.
The things that we usually look at is your lifestyle in retirement. Do you plan on snowbirding, traveling frequently, as well as what your healthcare needs are? Are you going to be seeing the doctor a lot? Are you not going to be concerned about seeing the doctor as much? As well as what type of coverage do you want? What type of care or conveniences that you would like to be included in that plan? And that's something that can change each and every year. It's not just right away when you're turning 65. Do we need to look at that? We need to look at those personal preferences and personal situation each and every year.
Yeah, really good point. Well, Ethan, thanks again for your time. If somebody has any questions, should they just call the main phone line?
Yep. Yeah. If you call the main phone line, they can schedule an appointment with myself or different Medicare specialists and be able to help get the answers and clarifications that they're looking for.
That's great. All right. Well, Ethan, again, thank you so much for your time today. I really appreciate it.
Thanks for having me.